In November 2011, we held events across England, in Kent, London, Birmingham and Leeds. We spoke to people who get support, their carers, commissioners, staff, big organisations and small groups, and they all came to discuss their experiences of social care and support. We discovered that there are two types of places that they live in: Serviceland and Together Town.
Hello, Maisie. It's been so long. How are you?
Oh, I'm alright. I've been moved to a new place, although I don't really know why. I was assessed, and someone said I had to move here. I didn't have control over what happened to me. They said it was to help me be independent, but independent doesn't need to mean being on my own.
Well, are you still managing to get out and about?
Well, I have tried to, but every time I suggest something, it's like the computer keeps saying no. I wanted to get support in the evenings so that I could do some interesting stuff like swimming and beekeeping, because I know I stay well when I get out and about and do things with other people. But when I filled out the form with these suggestions, my social worker said, you'll never get that past appeal. They put me to bed at 8 p.m. every night, as if I'm a child. I have no control over when they come or how they treat me. I want help to move on from these services and get my life back. I was assessed for something called self-directed support a year ago and met the right criteria, but nothing's happened yet, and they keep saying it's in the system. But what about you? What's it like in Together Town?
It's completely different here. I get all the information I need to make choices about what support I have, and the type of support is very different from Serviceland. The support staff do something called co-production. That means they treat us as equals and work with lots of other teams in health, other public services and community groups to help make Together Town a better place for everyone. They have joint policy making, and even the people who control the money take our opinions seriously. I have a lot more options now, and not all of it costs money. They try really hard in Together Town to involve everyone in the community and make sure they're able to use all the local resources, like gyms, libraries, town halls, community cafes, churches, faith centres, parks, and art galleries. The council works with local community organisations and businesses so these places are accessible and there's less stigma attached towards people who use support.
How does that work?
Staff work at times that suit me. They see it as part of their job to help me spend time with my family and friends, as well as meet new people. For the first time in such a long time, I've started working. And in my spare time, I've taken part in circles of support and time banks so that I can offer my skills and time to others. Everyone is valued for what they can do, not told what they can't do.
What can be done to make everywhere look more like Together Town?
We need a much more equal relationship between people who get support and those that have control of the budgets and make decisions about social care, as well as other services. Decisions being made about services and support and about people who get support should always be made with the people who are going to be affected. At its heart, this is about sharing power and control over our collective resources and working out the best way we can support people together. We need to think about the difference between services and support. This means the difference between keeping people out of the community and providing the right level of support to help them live their lives like everyone else. The first step away from services and towards support is to ask people what they can do and what their interests and skills are. Part of this is about having staff who are well connected in their local communities and not just staff who know about things like care and support. People who get support are involved in the induction and training of staff and can tell them what's important to them, what makes a good support worker, and what support they would most value. We also need to make sure people have access to different forms of support, including support which is outside of services, and particularly from other people who have similar experiences to them. This could be from peer support groups, user-led organisations, citizen expert groups, speaking up or advocacy groups, or online. We also need to think carefully about the language that we use. Describing people as service users, customers or clients, and even the term social care can act as a barrier to sharing power and making decisions together. It's not easy to create Together Town, but it can happen. It means that everyone in the system has to work together to change things.